Welcome to our HIPAA Basics and Best Practice training. Now let's discuss how we share patient information. Sharing patient information means providing them with control over their own health information. There are three main points to consider when giving patients control over their health information. First, only share patient health information with other individuals who need the information to do their jobs. For example, this may include healthcare providers, faculty, staff, students, residents, etc. Second, avoid accessing a patient's medical record unless you need to do so for your job or you have written authorization from the patient. Third, you are not allowed to access medical record of anyone unless you are part of that patient's treatment team. That include co-workers, spouse, significant others, or family members unless there is prior authorization. And keep in mind that you are also not allowed to go through your own medical records and using your entity-issued credentials. There are three circumstances that allow for sharing patient information without patient authorization. These include treatment, payment, and healthcare operations. The acronym TPO is typically used. There are also other specific examples. Treatment. You may disclose PHI to help improve patient treatment, which involves any activities related to providing healthcare services to patients. Treatment disclosure include sharing PHI with other departments or external providers, consulting specialists, or getting referral from third parties, ordering tests such as labs, communicating with other staff members as need, authorized patient personal representatives. Payment. PHI can be disclosed to provide or obtain reimbursement for healthcare services. Payment disclosure include billing, managing claims, determining eligibility for coverage, conducting collection or utilization review activities, insurance companies, and other third parties. Healthcare operations. PHI can be disclosed to improve operations and the quality of patient care. The following are examples: ensuring patient safety, quality improvements, financial analysis, educational or training activities. Other exceptions: imminent danger required by law and for public health. Minimum necessary requirements means that the use or disclosure of PHI is limited to the minimum amount of health information required to do the job. Most individuals involved with the various aspects of the patient's care do not need to have access to all components of the patient's health information. Policies and procedures govern the practice and uphold the high standards of practice required when caring for people. Now let's discuss circumstances where minimum necessary standards do not apply. When it comes to treatment, healthcare providers are allowed to use any information that is required to give care. This even includes the patient's entire medical record, when appropriate. HIPAA also allows appropriate disclosure for consultation and referrals, disclosures to patients themselves, disclosure authorized by the patient, and certain disclosure required by law. Well, there is more leeway for these circumstances. Covered entities must still limit the patient health information used or disclosed to what is needed to achieve the purpose of the use or disclosure. Thank you for your time. Please like our video to encourage us to bring more content online.